Namaskar, Sri Akal, Adab. Good morning, good afternoon, and good evening to all of you. Thank you for joining our live session. My name is Kunjan Mawar. हम हैं आपके host or those for this FP live session. Indian origin folks living in US. If parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobal has your back. If you are looking to contribute in televisit and build your network, eGlobal Doctors is formed by a group of physicians from UK, India, and USA. 290 plus doctors on board, 60 services, 8 plus different countries. Provide medical consultation, counseling services to patients from anywhere in the world, opportunity to provide charitable services to patients, be part of fast-growing innovative telehealth company with a chance to invest at discounted rate. Liability insurance will be provided. Visit or register at eglobaldoctors.com for more information. Today we have Dr. Prasad. He is board certified in pulmonary medicine, critical care medicine, sleep medicine, and internal medicine, and has been recognized as top doctors of Atlanta from 2019 onwards. Good evening, Dr. Prasad. How are you doing this evening?
Good evening, Kunjan. I'm doing wonderful. Thank you. Thank you, eGlobal, for giving me the opportunity to communicate to the people. Thank you again.
Thank you so much for sparing time. I know you're super duper busy and it's quite late. So thank you. We really appreciate it. So what do you say? Shall we just dive into today's topic?
Whatever you say. Let's go.
Okay, sounds good. That's the right answer. I like that. So we will be learning more about CPR today. So I'm going to start with, what is BLS training?
BLS stands for Basic Life Support. So the other name for that is also cardiopulmonary resuscitation. So basic life support is the immediate thing that anybody should do to revive a patient whose cardiopulmonary system is compromised. So that's BLS. So after the BLS, there is this thing called ACLS. ACLS is Advanced Cardiac Life Support. That's only for physicians and medical providers, nurses, respiratory therapists, pharmacists, and the physicians, nurse practitioners, physician assistants. So that is meant for medical personnel. That is advanced cardiac life support. Whereas BLS is the basic life support, which involves simple steps described as chain of survival. And that is what is the steps that are needed to revive the life back again.
Understood. So thank you. So BLS, if somebody is trained and certified, BLS is for them, but the advanced that you mentioned is only for the people who have medical knowledge and information.
Right. That's right.
Wonderful. So what are the basic guidelines which are used in this kind of training?
So the guidelines that are used all over the world are done by American Heart Association. So they come up with these guidelines with the new data and the science that is coming out of the resuscitation science. So every few years or so, new guidelines come. The current guidelines on that are, published on that American Heart Association, and they are the ones who run these BLS certifications all over the world, and especially in America. So American Heart Association .org or it's heart.org. Yeah, BLS.
Okay. So what are the main elements and priorities of BLS?
So let me see if I can share that screen real quick. So the main priorities are basically, one, it is, most important thing is the safety. So if one person is in grave danger, as you are trying to rescue that person, you want to make sure that he is in safe position, the person who is going to rescue, and you are in safe position. So, and then second thing is to make sure that it is effective, safe and effective. So that's a safe and effective way to reach the goal of return of spontaneous circulation. So effective means you got to do the chest compressions to support the heart. and you do the shock or defibrillation to bring the heart out of the rhythm. And number three is that you support their lungs by giving them the breath and then the oxygen that is needed. So those are the goals. Basically, you want it to be safe for everybody involved. Number two, that it is effective with the ultimate goal of patient being able to be revived. So if it is done properly, so only 10% of the people survive any kind of these cardiac arrests, and you can triple or quadruple your chance of reviving the patient to a survival state. It's giving
Wonderful.
life.
So that was actually one of my questions down below, that what is the survival rate? So wonderful. That's actually good to know. So if done right, the chances of revival are much higher.
Right. Absolutely.
So what is the first thing, like if I am in a situation and if I see somebody is choking, what is the first thing that I should do?
So you want to, if the patient is choking and if they are not in a lot of distress, you should still try to communicate to them, asking them the simple questions, like are you choking? Are you having any trouble? As long as they are conscious and they are not having any signs of lack of the blood flow or lack of oxygen, then obviously they're going to lose consciousness. Until that point, you try to do simple things, and as long as they are conscious. So, and if they say that they are choking or they kind of somehow communicate, there are signs that they are deteriorating, then obviously you need to consider doing relieving that obstruction or from whatever is causing the choking, right? In adults, it is done differently. In children, it is done differently. And that is why it is essential that, everybody go for basic life support training. And I say that it is as important or even more important than getting a driver's license. See, everybody who gets a driver's license, I think, should be mandated to get basic life support, because it is a single most important thing, and that is going to bring somebody who is in need to be able to brought back. At least the efforts are given, and so that the person is not going to feel helpless, not able to help the victim or somebody who is in need. So it is not something, we can just learn in about an hour or so session, but that's why I encourage everybody who's listening to this to definitely go for BLS certification. And, we are going to give a brief introduction of what it is and what is involved, so that there is enough of motivation to people to go and apply themselves and get a life-saving skill.
I completely agree with you. It's a wonderful way to put the things together, that our life is dependent. If we get into something like this, hopefully nobody gets into a situation like this, but if we do, then if people are certified, if they are trained in the right way, then, we could save somebody's life. So that's a wonderful way. And I hope somebody is listening to us right now and they would implement what you suggested. So driver's license and mandate BLS training. So I'm going to move to my next question, Dr. Prasad. So how long should somebody do CPR before, they need to ask for help or go to the next level? Like someone like me who doesn't have any medical knowledge, if I am giving somebody a CPR, how long before I actually know, okay, it's not working, I need someone else?
Actually, you call in the help immediately as soon as you recognize. So if the person is, you recognize that somebody need help, you go and assess them. Are you okay? Make sure it is safe first for both of you. And the next step is that step 2 is like you try to assess the patient. When you assess the patient, the important thing to remember is the triangle of life. So the brain, the lungs, and then the heart. So these 3 are the ones that are constantly maintaining the life, the circle of life. right? So by asking that simple question, are you okay? Or tapping on the shoulder to make sure that they're responding. That is the first important thing. If they are not, and you notice that they are in danger, you immediately activate emergency response systems. In India, it's 108, here it's 911, and it's depending on the country, it changes, but you activate, you ask for, you shout for help. And when somebody responds to it, you tell them to get some AED and help, right? So AED is automatic electrical defibrillator. So that is the one that is going to save lives also, in addition to the chest compressions. So without that, certain types of this rhythm problems, the sudden cardiac arrest, they are not going to be revived easily. So that's why very, very important. As soon as you recognize it, they're not responsive and they need help, you ask for, either shout for help if somebody is there. If not, immediately you can activate the emergency response system on your mobile. Just call them while you're trying to assess. Once that is done, that's when you go back to the patient or the person or the victim and basically trying to assess their pulse and their breathing. Within 10 seconds is what is recommended. Within 10 seconds, you need to check their pulse and at the same time see whether they are breathing or not by visual inspection. So while you are doing the pulse check, you are actually look at their chest raise and see if they are breathing or not. So that's step number 3. Make sense?
Can you, yes, it's absolutely. And I was going to ask you that, can you repeat the triangle of life just in case, for our listeners and viewers, that's a very helpful information.
Right. So the life depends on having this, the circle of life maintained. It is basically supplying the oxygen that is needed for the whole body. So where is it coming from? It is coming from the atmosphere. We are breathing in. That air is some of it. The oxygen out of that air is getting into our blood. That's a fuel for our life. Then that fuel, along with the food, is being pumped by the heart, right? That's the second part of that triangle. So that is being pumped along with the oxygen in the blood, along with the calories or the energy in the blood is being pumped. So that is being pumped from this level to the brain and to the rest of the body. And once it reaches the brain is using that energy, using that oxygen to be able to process whatever we get through this third part, which is the apex of the triangle. So basically what you are looking at is like the brain function. So your assessment for any BLS or basic life support involves assessing the brain by asking the simple question, assessing the pulse, that means you are looking at this heart, and then assessing the breathing, that means you are looking at the lungs. So if you do these 3 together very quickly, you will know whether the patient or the person needs immediate BLS or not.
Wonderful. Thank you. And I think you also touched upon a very important point, which is AED. So, in malls, in shopping complexes, in our office, we don't go to office these days that much, but, we should always know where the AED is located for that particular floor. So that's a wonderful suggestion. So we talked about when somebody is choking. For someone like me with minimal or nothing medical experience, how will I know if somebody is going into cardiac arrest?
So you're checking, like I said, the step 1 is making sure it is safe. Step 2 is making sure they are responsive or not. If they are not responsive, and number 3, you activate the call for help, shout for help, and you call in the emergency response system, step 3. Step 4, you are checking the pulse and breathing. If you don't feel the pulse, so when you check the pulse, so you put your, this is a windpipe that's in the middle of the neck, right in the front, straight in the front. And then you move to the right or left, and there's a groove where those muscles are. So you put your hand there to check the pulse. This is in adults. And then you feel the pulse. So you take about 5 to 10 seconds to check that pulse. If there is no pulse, and if they are not responsive, and if they are not breathing, that means that you immediately need to do chest compressions. So the chest compressions, then you need to put the hand on the, this is the sternum or the, so if you can see here on this mannequin, so this is the sternum or the breastbone, and the bottom of the sternum is this, that's a triangle, that's the xiphoid process. And in the bottom half of that sternum, you put in your hand, a locked hand, and that's where you do the chest compressions. And the frequency, how frequently you do it, depends on the age of the patient. I mean, frequency is always 100 to 120, but the depth is dependent on the age of the patient. So in adults, you push in 2 inches in. In children, one third of their chest wall. That's how much you need to push in. By doing that chest compression, what you're doing is you're pushing on that heart to pump the blood so that the blood circulation is established, right? So that's about the pulse. So at the same time, while you are doing the pulse check, you're also looking to see if they are breathing, right? If they're not breathing, for every 30 compressions, you need to give 2 breaths. So in this COVID times, with this pandemic times, when we do not know the status of the patient, if you are not comfortable giving any kind of a breathing, just hands only CPR is also recommended. But if you have some kind of a one-way valve mask where you can give the breath to the patient, that is recommended. So you do the 30:2 chest compressions to ventilations.
Okay, so 30 press compression and then 2 ventilations.
2 ventilations.
So,
and yeah.
So I'm going to ask one question, and then we're going to go to the demo. So you mentioned that everybody should be trained in BLS or CPR. So how can one get trained? Like, is there a website to go and register? How do we get this kind of training?
American Heart Association, BLS, or you can Google anywhere, depending on the country where the viewer or audience are. So definitely they can search for BLS nearby and get a reputed place where you are well trained, because this is a important skill that need to be honed. When it is needed, you need to be absolutely certain of the knowledge and very certain of the skill that you have. So that's why there are places where you can go get a cheap, easy way, quick way to get that certification. But that's only a, bragging right only. But when it is time to really save somebody, your skills and knowledge, when they are put together properly, is what is going to save the patient. So our efforts are going to be a lot more important in that situation. So as you know, there are like 2 recent cases. Puneet Rajkumar, who was he was a fitness buff. He was a famous actor from Bangalore, Karnataka. He was very, very fit, and all of a sudden he had a cardiac arrest. And if there is some, if there is somebody who could have this simple BLS around him, I'm very certain that the outcome probably would have been a little different. Because if it is, there are 2 things. One is a heart attack, and the second one is a cardiac arrest. Those are the common reasons why people go into the cardiac arrest, right? And sudden cardiac arrest or sudden cardiac death, we call, is usually an electrical phenomenon. Whereas the heart attack is a structural phenomenon. That means the blood supply to the heart suddenly stops. That's why the chest pain occurs, or multiple other symptoms that can, manifest. So that's heart attack. Whereas sudden cardiac death is like an electrical phenomenon. Normally, we have these upper chambers of the heart and the lower chambers of the heart. Upper chambers of the heart, there is a pacemaker. That's where the electrical rhythm is being generated. So there is a nice rhythm regular rhythm that we all go through. That rhythm is what is going to make the muscle contract. That rhythmic regular contraction will allow heart filling up with blood and then followed by contraction, filling up and contraction. So that wave pattern is what we feel when we feel the pulse. In adults, we ask them to check the pulse on the carotid. Carotid is, what we were trying to check. In children, we check it in infants, we check it in the arm. In children less than 8, you can check it in the neck or in the groin.
Okay, wonderful. Thank you so much. That's actually really good information. And I did not know there was a difference between cardiac arrest and heart attack. So now I do know that. So thank you for educating. I always thought it's one or the other. It's